World Brain Tumor Day is observed on June 8 every year to spread the awareness and to educate the people about the brain tumor. This was initiated in the year 2000 by the German Brain Tumor Association, and spreading awareness is by conducting the public lectures, seminars, social media campaigns and fundraising programs. There are various myths and misconceptions regarding the brain tumors. So what is a brain tumor? A brain tumor is an abnormal growth of a brain tumor is a growth of abnormal cells in the brain. It can affect or disrupt the brain functions. There are very myths and misconceptions, as I told you, about brain tumor. Okay, and many the causes are exactly not known, but there are certain causes telling that exposure to long time of radiations, for example, X-rays. So working in X-rays for long time radiations, exposure to long time radiations, it can lead to brain tumor. There is no exact cause actually, but it's supposed to be told. But exposure to chemicals such as nickel, then vinyl chloride, benzene. So these things can also can lead to the brain tumor. So brain tumor can be benign as well or malignant. So benign means it's not cancerous, malignant means cancerous. So it can either begin in the brain itself, it is told as primary brain tumors, or it can be starting or beginning from the other parts of the body, then it can spread to the brain. It is told as secondary brain tumors. Now, the chronic stress, one of the reasons stress can even trigger, like chronic stress can trigger the sympathetic nervous system and the neuroendocrine system. So stress is an important factor here, it can trigger the sympathetic nervous system. So some of the examples of brain tumors are gliomas, you can say, astrocytoma, oligodendroma, neural cell tumors, okay, acoustic neuroma, embryonic cell tumors, embryonic tumors, you can say, example, medulloblastoma, penile tumors, pituitary tumors, meningiomas. Okay, these are many of the examples for brain tumors. It can be benign and malignant, I am saying again. And the thing is that it can affect or impair the brain function. So what are the symptoms you can see here? The symptoms, the main symptom is the headache. Headache, you can see some kind of pressure in the head. It will be worsened in the morning. So this kind of headache, typically the headache is a classical symptom, and doesn't mean every headache is a brain tumor. Okay, so headaches, visual disturbances, okay, lack of interest, loss of smell, so vomiting, nausea, visual impairment, as I told you. Even hearing impairment also can be affected. There can be difficulty in walking, difficulty in speech, paralysis of one side of the muscle, hemiplegia can be there. So these many symptoms can be as a part of brain tumor. So even facial numbness is also be told as a symptom of brain tumor. There is no age group we can tell in brain tumor. Brain tumor can affect any ages. It can affect the cognitive and physical functions of the body. It can affect the emotional state of well-being. Obviously, it's a continuously headache, vomiting and all. Who will be happy? The emotional state itself is unstable, you can say. Every time it is a sad face, a disgusting, it can go to depression also, because every time you have a headache, it's very difficult. So exact cause, you cannot say what is the cause. You can prevent by avoiding long-term exposure to the radiations or like chemicals such as I told you, nickel, vinyl chloride, benzene, all those things you can avoid. Even cadmium, you can avoid the exposure to these things. Abstain from smoking, from any types of drugs. Okay, drugs not for the treatment of a disease, drugs like addiction, you cannot go to addiction. So these you can abstain from these things. What can be the investigations done to find out the brain tumor? Mainly MRI and CT scan. Okay, MRI is preferred mainly for the brain tumor. So one more thing we can do is PET scan, or there is something as SPECT scan. SPECT scan is over PET scan is because SPECT scan can even involve to find out the that cellular changes can be noted in the SPECT scan. So SPECT scan can be preferred now over MRI and CT. But MRI and CT is the main thing. MRI is the one which is frequently done everywhere. There are 3 Tesla now most of the hospitals. Then there is angiogram as an imaging technique. Then neurological examination like sensory system examination, motor system examination, hearing test can be done. All those can be done as a part of the neurological examination. Okay, hearing test again. Visual test, okay, cranial nerve examination, mainly the second cranial nerve examination, the 8th cranial nerve examination, or PTA can be done. These other things can be done as a part of investigation of brain tumor. What is the treatment here? Surgery. Surgery is the first step of treatment in the brain tumor, whether it is benign or malignant. Okay, and in investigation, when you do surgery, you can take a biopsy if you want. Biopsy can be taken when you do a surgery. Radiotherapy, chemotherapy can be done, steroids can be given.